On this Google Hangout, I'm joined by Emily Van Schenkhof with Missouri Kids First, who is joining us from her home, right, in Fulton, Emily?
Yep, I'm home. I needed a break from the Capitol.
I don't blame you. And stuck at the Capitol, I guess we could say, but still at the Capitol today. Colleen Coble is with us with the Missouri Coalition Against Domestic and Sexual Violence. Colleen, thank you for your time. She's here with me.
Glad to be here.
We're going to talk about Senate Bill 341, which was passed out of the Senate, out of the legislature this week, and is awaiting action by Governor Nixon. And there were some key issues in that bill for both of you. There were several things that the bill did, but two that I think we're going to spend a lot of time on in this hangout. And Colleen, why don't we start with you? This bill did something for sexual assault and sexual abuse victims that Missouri has never had in place that I think would surprise most people.
With the passage of, and credit to Senator Riddle for her Senate Bill 341, for the first time, rape victims and sexual assault victims will be able to get orders of protection in Missouri. They are available for free at the local courthouse. You don't need an attorney to get them. It's a civil order that, when violated, has a criminal penalty. And the changes in the law made certain that those who have no previous connection with the person who's harmed them can get an order of protection. And
again, I think a lot of folks in Missouri probably assume that that could already be done.
Absolutely. The orders of protection have been in place in Missouri since 1980, but they were restricted to those who had a household or family relationship with the person who harmed them for domestic violence issues. And then later on in the 90s, we amended the laws to cover those who were victims of stalking. But there was a big hole in the law, and a big a hole also in our response to help sexual assault survivors, both adults and children, be safe. And with the passage of this bill, that has been fixed in Missouri law.
How important is that? I know that it maybe on its face sounds very important. Does that do these orders of protection, I mean, do they really carry enough weight to truly help in these situations?
It's an enforceable order of the court. It can provide safety for the survivor in their workplace. The offender can be restricted from showing up there, from communicating with them in any way through a text, a phone call, even harassing Facebook posts or other social media. It can protect your other household members who might be subject to harassment from the person who's harmed you, your roommates, your children. It really is more than a piece of paper. It is a recognizable, enforceable order of the court, and it also can allay the concerns of a lot of survivors that they have to be continually looking over their shoulder and worried about ongoing harm or threats from a person who has obviously already harmed them. The other thing that is important about the changes in Senate Bill 341 is it revised the definition of sexual assault for obtaining an order of protection. So now it is the same as the criminal offense. And in Missouri, all of the sex offenses have an element of them that the victim did not consent. A lack of consent is now a part of the definition of sexual assault or sexual offense for orders of protection. And that covers someone who is incapacitated, who is incapable of consent, who's passed out, who is on medication, or who is disabled. So there's a lot of ramifications from the passage of this bill, all of which will serve to provide greater protections to victims of sexual assault. And it covers both adults, teenagers, and children.
And of course, we would never ask you to reference specific cases, but I know that in what you do, what you advocate for, you've probably heard of many cases where either one of those changes would have helped folks that now, at least going forward,
that option is there. Yeah. That option is there because very often the unfortunate truth is that people are sexually assaulted by someone that is a neighbor or someone they know is an acquaintance, but they don't have a dating relationship with them. They never lived with them or have a family relationship, and they were just left out of the solutions that we have in Missouri law for protection. So this is a big step forward.
All right, we'll get our earbuds back because I'll go to Emily here for a moment and talk to her about one of the other components of Senate Bill 341, Emily, and you called this your biggest priority for this legislative session.
We're really excited about the pieces that we worked on in Senate Bill 341. We're really excited about the orders of protection piece. It will mean a lot for child victims of sexual abuse, for adult survivors of child sexual abuse. So we're super excited about that. Honestly, this whole bill was a pretty darn good bill, and that's just, it's fun to be a part of something like that. But the pieces that, that I've been working on for about the last 3 years is the piece that authorizes our Missouri's Children's Division to provide family assessments in cases of juveniles with problem sexual behaviors, or cases where a child is being molested or sexually abused by another juvenile. This is something that we have been known for quite some time as an issue and a problem. Our statute that governs how our child welfare system works requires that the person who is committing the alleged offense against the child had care, custody, and control. And so when our hotline received calls from folks who were concerned about children being sexually abused by other juveniles, those other juveniles typically didn't have care, custody, and control. And so so Children's Division wouldn't often intervene to provide any sort of resources to the family or look into what was going on. And oftentimes they would try to make a referral to the juvenile office or to the law enforcement agency. But when you're talking about an 8-year-old and a 5-year-old, there's not a lot of criminal culpability there, and there wasn't a lot going on. So this was kind of just a gap in our laws, and a gap where kids were falling through. And so we were leaving children who were being molested by other juveniles in really bad situations. And we also weren't doing anything to try to address that older juvenile that most likely, although certainly not entirely, had probably experienced something that they should have never had to experience. We really do believe that this is an early intervention strategy, that people don't just wake up one day and become sex offenders. They don't. This is something, it's typically a learned behavior, and it typically does start when they're juveniles. And so if we can intervene earlier and more appropriately with these juveniles, we have the ability to save and to help other victims, and to help kind of alter their life trajectory in a way that gives them a lot of hope and potential. So we're really excited about this. The Task Force on the Prevention of Sexual Abuse of Children identified this as a problem 3 years ago, and oftentimes it takes some time to craft a solution. You don't want to file legislation the minute you've sort of identified a problem. You have to, get your team of people together. You have to work through the kinks of it. You have to think about who'd be the best person to do it. So we really spent the time to do that. And so we came kind of with this proposal at the beginning of the year, and weren't entirely sure how it would be received by the General Assembly, and people really got on board with it. People, I think, very much understood this was an issue and something they wanted to address, and we're just thrilled that it made it across the finish line, because you work all year, and things can fall apart at the end. And so we're just really thrilled that we were able to get it there, and with a week to spare, which actually is like, whoa, how do we do that? So feeling really good.
And similarly to what Colleen and I have discussed about the issue she and I just talked about of sex offenders, sex abuse victims, being able to get orders of protection in what you're talking about, cases of juveniles abusing other juveniles. You see, one of those situations where, as you came to lawmakers with this, and as you came to others with this to say this is an issue, if they had experienced it for themselves or heard of these situations themselves, most people probably don't think of this as even being a problem.
I mean, absolutely. I think that a lot of people knew that this was happening, and certainly it's amazing to me. I've had several legislators that, as I was talking to them, told me about constituent issues or family members or similar experiences. But I think that people didn't realize that we weren't actually providing any, I think most people didn't realize that Children's Division didn't do this. So people within our system sort of knew that and knew it was kind of a problem, but I don't think that everybody else sort of realized that these kids weren't getting the help that they needed. So that was kind of an educational process. And but once people realized that, they were like, whoa, geez, yes, we should fix that. And we had tons of partners that worked with us on it. The coalition worked with it on it. Missouri Children's Leadership Council, Empower Missouri. There are just lots of people that said, oh gosh, yes, this is a problem that needs to be corrected. And then, I think that there at the beginning, some legislators were, questioning, is this the role of the state? Or they had some questions, but once we kind of explained it to them, they were like, okay, yeah, I don't have an issue with that. So it was not one of the harder things that I've worked on, kind of, at least once you got to the process of kind of moving it through the building. It was it was not really, people instinctually and kind of intrinsically got on board once they understood the situation.
And to me, the follow-up to that question for either one of you or both of you is, I mean, it makes me wonder what other issues are out there that would seem obvious once they're raised to us that need to be addressed. And so, I mean, I assume that there's probably some others that you could follow up in the next couple of years that are similar to this, that once you have the chance to explain it to people, yes, this needs to be dealt with, but it just, no one really thought about it. No one realized it was an issue. I mean, are there more things out there that are sort of obvious?
Absolutely, and I'll answer that and then turn it over to Colleen. But from our perspective, the two things that, I mean, and maybe they're kind of really the same thing, but is mental health services to children who have been sexually abused, and then mental health and treatment services to youth with problem sexual behaviors. So these two groups that really we all know deserve an appropriate therapeutic intervention to help them heal and to help them change. And I think that we haven't done enough in those areas. And I really fully believe that any child that has experienced sexual abuse or physical abuse needs to have an opportunity for an appropriate therapeutic intervention. And doing good therapy and good therapeutic intervention is harder than it sounds. It's not just any old therapy is not, all therapy is not equal. We need evidence-based services on both of these sorts of, on both of these issues. And so for me, that's kind of the next place that we'll turn, the next area that we'll turn is where and how can we improve our access to mental health services for these populations? So that's the thing. And again, I do think that's something that people understand. You're absolutely right. These folks need an appropriate intervention, and also that they need to be evidence-based. We need to be pushing our systems to get better, pushing our folks to do this better and to learn new things and incorporate it. And, as we know in the building, and none of that's easy. If it was easy, we would have done it 10 years ago. It's hard to do this work, but you got to put some time and effort into it, and some money, of course. Got to put that in it.
Do you have any issues like that, Colleen, that to sit here and say, yes, this hasn't been done yet in Missouri, most people would think, oh, I can't believe that hasn't been done. Just sort of obvious things that you can see looking to in the next couple of years.
Well, I think that the passage of this bill shows that when you do bring often neglected issues or emerging issues to legislators, they will see the value in passing legislation and do it in a bipartisan way. We found that clearly in Senate Bill 341 to address the needs of children who were abused and who need help so that they can have those issues addressed, whether they be victims or juveniles with the problem sexual behaviors. We saw the problems in not fully addressing what sexual assault victims need in orders of protection. And I think one of the strongest things that we can do as advocates is when laws are passed, find out how they are being implemented in the community. Is there another layer of response that's needed in the statute to help address the trauma and the needs of victims of crime of any age? So it's there have been important measures that have passed in the last few years that we're just now starting to fully implement. I think that Emily's right, and we would join in echoing the need for restoring mental health services and even expanding them. So many of those families that we serve have multiple needs, and very often there's very limited resources for them at the community level. The other issue is the nexus between poverty and levels of violence that are often experienced in families. And with the recent override of the governor's veto of some pretty significant changes to Missouri's public assistance laws, we're going to have to do a lot of work collaboratively by lots of different social service and advocacy organizations to address the impact for impoverished children and their parents in Missouri. We got a very clear public policy message from the General Assembly that they wanted to make those changes. And now we're going to have to see what we can do to work with those families at the community level to make sure that their well-being is ensured as the law is being implemented.
All right. No one ever wants to, of course, speculate, myself included, on what the governor is going to do with any piece of legislation. The three of us can certainly look at this bill, Senate Bill 341, and say, well, surely he'll sign this, barring some technical problem that no one's caught yet. But that's the real question now, is just waiting to see what he does with it, right?
I have every expectation that this is in line with issues and priorities that the governor has acted on, both when he was in the Missouri Senate, when he was the Attorney General, and now as governor.
Emily?
Oh, I think the governor's going to love this bill, personally.
All right. Well, ladies, thank you both so much. I know we'll be talking about some other issues from here on out and in